Welcome everyone here to Healthcare Leadership Live. We have a special edition here of Healthcare Leadership Live because we have breaking news and some analysis of the recently signed legislation, the big, beautiful bill. And we'll find out how big and how beautiful it is here today. And I have a guest here to help break it down. His name is Mitt Mehta, and I've spoken with him before, and it has a lot of insights here to share on this bill. And just as a quick reminder, this show is targeted for healthcare leaders to get better insights, to be better leaders, to be better informed. And this bill, well, we're going to find out here in a minute, but it has things that affect healthcare, but affect us all. And so, Mitt, thanks for joining me here to chat about the bill.
Yeah, absolutely. It's pleasure connecting with you again, Mike, on another session. And I think it's perfect timing. It's Saturday. Sorry, it's a Sunday. We're all relaxed. And I think we've put what I've done in the recent past. It's gone back and forth between the House, Senate, back to the House. So what we have analyzed is the latest version as of the June, I believe it was June 1st, end of business. So they finally published the last version of the bill that got passed by the House. So right now, actually, as a matter of fact, the best of my knowledge, it's not official that our president has signed it yet, but it is speculated that he will sign because he pushed to have this accomplished by
Yes.
the House. So definitely it's worthy of analyzing this version because this is most likely going to be the final version.
Okay. And
Yeah.
I have reports that he did sign it 2 days ago. And
Oh,
so
nice. So they
yeah,
haven't updated on their website, so that's good.
yeah,
That's
so let's dive in here. By all accounts, this was a very wide-ranging bill that I'm sure has impacts for business and individuals. But maybe let's start with something that really stands out for you. Is there, if there's any one thing that you would say jumps out for you on this bill, what is it?
so I think what stands out is that the tax rates. The tax rates are maintained at the levels that are needed to keep the average middle class income group sustainable. Because if the bill did not sign, we would be retroactively going back to our old and inflated tax rates, which would definitely create quite a bit of disruption. And I don't think we even saw a path forward where they would maintain the tax rates and sign a bill exclusively to cover the taxes. So if this were to happen, or not to happen, sorry, then the tax rates would have been impacted. So the biggest impact is the tax rates. And what they're doing is permanently extending the favorable tax rates they signed back in 2017 timeframe. They're just keeping that going forward. So they're not disallowing or disengaging those tax rates.
Okay, so tax rates staying the same. That's good. Not
Yeah.
going back up. That
Yeah.
that should be good. That should be good news for us
It's
individuals.
37% at the top at like 600K for married filing joint, 500K for single filers. So I think that's the cap tax rate, 37%. Obviously, that's definitely not the cap when you have investments, you have AMT and IIT, so you'd be somewhere in the 40 something percent. But yeah, that limit has stayed the same. It's being extended permanently, which is a good
Mm, okay, that's good.
thing.
That's good news for us.
Yeah.
Okay, so that's good news. And I know you have a list of things that you've picked out from this bill, and maybe we can hit those in a minute. This bill has not been popular across all spectrums, right? So is there one maybe controversial thing or maybe one item that has received the most raised eyebrows across the US?
Yes, absolutely. And the one that kind of raises the eyebrow the most is the Medicare topic. It's the most impacted topic, and it's a little bit trivial there because they're creating a policy where, where work is absolutely necessary, or education or something's necessary to be qualified for Medicaid. That is actually one of the actual aspect of it. So I'll go over that if you don't mind. I can
Yeah,
go.
let's do it. Let's jump into that because that's a huge program that any change
Yeah.
to that is going to have big impacts.
Yeah, so I think what's happening in Medicaid is purely the moratoriums on eligibility and enrollment. So they're creating some rules around that. They're they're creating new requirements for states to prevent duplicate enrollments and verifying deceased individuals, which is a good thing.
Sure.
Stricter alien eligibility rules, and that's effective October 1st, 2026. But the story there is they just want to make sure that they're giving Medicaid to eligible citizens in the United States, so not handing it over to non-resident aliens potentially. And then there's the other aspect is the home equity limits for long-term care eligibility. So it's state based, so that's definitely the case. And then the main aspect of this is encouraging individuals to go back into the workforce to qualify for Medicaid,
Yeah.
which is the most troublesome area from that perspective. And I think a lot of folks are not happy with it, which will put a lot of people in a bad situation. Now, the bill does specify that is able-bodied workers, right? So if someone has some disability or something, then they're qualified to get exempt out of the Medi program. And if they're not qualified for the right skill set and they're studying, then they would qualify for Medicaid. So it's controversial, but I think the the idea behind this, or I think those who support this program are encouraging people to get back to work and not be lazy at home and do nothing. So I think it's a good move to reignite the economy to start working if they want to be covered under Medicaid. Whether you will or not, that's a secondary question. And then indirectly, it automatically eliminates non-resident aliens in this process because non-resident aliens will have a hard time proving employment in current conditions. So it plays a double role there.
Yeah, certainly one of the keystones of Trump's campaign and his presidency is to limit access of undocumented people to public systems. And obviously, that would be consistent with that. And another element would be getting people off the dole, basically. And if you want this, you're going to have to do that. And that does make sense, right? But it will be interesting to see how people will be affected in the end in terms of their access to healthcare, which for a lot of people that's considered a basic human right. It's easy to see why the country is a little divided on that.
Yeah. If you wanted to dive deep into exactly how it impacts healthcare, I would say the biggest impact would be the FQHC clinics,
Mm,
federally qualified healthcare clinics, because they rely on Medicaid quite a bit as a potential patient. So they receive money from grants from Medicaid to keep their operations running from time to time. So what I have sensed from the bill is that it's like it's going to drive the volume down, right? Because right now any person can walk into the clinic and get free treatment, free health treatment, even if it's a minor treatment or major treatment, anything, it's covered under Medicaid. But if this gets pushed through, which it's already signed now, then less people will have access to healthcare in the early stage unless everyone decides to get back to work and start working. Those are the pitfalls
mm.
I see there potentially. And then if that happens, then volume decreases at the clinics. And those nonprofit clinics are banking on potential volume.
So yeah, I hear from a number of people in my social media feed about the crumbling rural healthcare system, which I would guess a lot of them, I'm not an expert in that area, but I would guess a lot of those hospitals and clinics depend on Medicaid patients. And so could see a lessening of access as hospitals close, clinics close down. And that's a worrisome thing if that's one of the outcomes.
Yeah.
Now,
Yeah.
I also wonder, I think a lot of people may say that, hey, man, it's harder than ever to find a job. And if I have to have a job to get Medicaid or be pursuing a job, I know in DC, a number of jobs have been cut. I know a lot of people, again, in my social media feed struggling to find work right now. And that could be a very troubling development for folks if they're finding access to care being harder to get, and from what I understand, there may be some changes in ACA subsidies or healthcare subsidies for individuals in this bill. Is that something that came up in your analysis at all?
Yeah, so I think ACA is not too impacted indirectly, but the subsidies are going to be adjusted for that.
Okay.
But they were already accounting for employment and all that into that equation. So I see most of I think what people would do is people will opt for the ACA healthcare over Medicaid. So there'll
Yeah.
be quite a bit of enrollments in that space, is my assumption based on what I think we'll see. But then that also requires income as well. So it's a double whammy. It's I don't know how an individual can say that, and I don't know if there is a motive from the poverty segment of the family or close to middle class that says, look, I want to get a job, but I don't want to make too much so
Yeah.
that I qualify for this. So that's the mindset the average family that's in that phase will have to think through, right? Like, how can they determine how much they make so that they qualify? They don't typically negotiate downwards with employers. So
I've
ideally,
seen it happen.
but
I've seen
going back to the
employees.
jobs, yeah, going back to the jobs thing you talked about, Mike, I think what I've seen is the jobs growth has been there. It's mostly on the lower scale jobs, right? So like when the data is published, like everyone's, oh, we have all these layoffs and we have everything, and why is the number still reflecting the right numbers
Mm,
to support those interest rate cuts and all this? And the reality is that most of the middle class, upper middle class jobs are getting cut for a lower class, middle class job, like just the mainstream jobs that are out there needed to serve humanity,
yeah.
ideally. So I think those are a little bit growing and expanding, but the desk jobs are going away.
Well,
Microsoft just announced 9,000 layoffs just last week. So it's going to be even harsh, brutal as well.
yeah, no, I've heard it's the market for professionals has been very difficult lately, and there are people out there depending on access to healthcare, subsidies, Medicaid, and it'll be interesting to see how those things are affected. What other parts of this bill seem to be substantial from your perspective?
I think, interesting enough, not trying to encourage everyone to get into the business aspect, but I think it's very business friendly, is what I think on a positive note. So I feel like it's encouraging people to get into more entrepreneurial settings than get into the workforce. And it's not directly implied, it's indirectly implied, right? Especially those in the upper middle class bracket and upper class. What we're seeing is the expansion of the 100% bonus depreciation, permanent depreciation. So I think it's like close to 1.1 million. So that's an interesting space where people can start writing off their income, off their W-2 income, or they're transitioning into a employment versus the entrepreneurial setting, and that's going to be advantageous from that perspective for a lot of businesses. Now, healthcare businesses, I'm not seeing that expand as much. I think the ones that will expand are more asset based businesses. So equipment and major things, major assets that can be truly depreciated. Those
Mm,
are taking off because that's an opportunity from that.
okay. So better advantage for capital expense depreciation.
Yeah.
Is that I'm not a finance guy, so you might have to break it down, but maybe encouraging more capital investment and things
Yeah.
like that.
Yeah. Capital. So, like, the best way to put it in layman's terms is if someone bought like a $250,000 equipment from a group and they had 250,000 in income, they can wipe that income off
Ah,
with that expense rather than taking it over multiple years. So
okay.
then that can help them tax wise from a
Mm,
business standpoint, from a personal standpoint, that if they have substantial income, it can help wipe out all that income down to a lower tax bracket
okay.
potentially. 37% tax bracket or 30 something percent bracket, they can bring it back, effectively bring it down to 20%. So
Mm,
they can save money that way because that's an expense towards a business. Even though it's a capital purchase, it's treated like an expense
mm.
ideally. Yeah, so that's
Okay, yeah, that would seems like it would be significant for larger businesses that have money to invest in expensive technology and machinery.
yeah. And then double clicking on this stuff on the healthcare side, right? I'm just thinking this through. The other thing that's been approved that's new and it's temporary through 2028, I believe, but it's new in the big beautiful bill is tips and overtime. So that got passed, which is something totally new and creative that Americans have never seen.
Yeah. So if you can just to stop on that for a second. So
Mhm.
what I think you're saying is from what I heard is that tipped employees, and I've worked a lot in the restaurant sector, so I know this is a big thing. Tips and overtime pay are now exempt from taxation. Is that right?
Yes, but the stipulations are not fully clear to a lot. So those who read the big beautiful bill will get the stipulations on that. So they're exempt up to $25,000
Okay.
max. So if anyone's getting more than 25,000, that's not eligible. So that's the limit. And there's another limit as well, actually, which is not truly shared in public yet, but it's on the bill. Is there's a limit for single earners who are 100K or married filing joint 200K. So as a couple, if you're making more than 200K, your limit threshold has already crossed. That qualification criteria goes away. But I'm glad that they're at least encouraging it for lower income earners, which is where majority of the difference is made. So I'm happy to hear that. But I would say if we're looking at potentially like anyone that's a mid-level or higher, like someone that's making 100K or higher and their family and their spouse is making similar, they're not qualified
I gotcha.
for that. Mid-level meaning like nurse practitioners and physician assistants.
Yep.
This would be anyone like that's medical assistants or below, ideally working at front desk medical assistants that would
Mm,
qualify. And in healthcare, I think the only advantageous I see not the only, but the mid prominent is overtime. Overtime.
mhm.
So I think that will make a difference if there are healthcare groups that still pay overtime for their workers and they're on hourly, which is typically on the lower range of the spectrum. And then on the tips in healthcare, I'm still doubting that would even make it through because it's hard to see that in that workforce setting. There's a little controversy there, right? Getting tips and all that. But if there's med spa services offered at those settings, then there's an opportunity, right? Like for tips. So
I think I have heard of that. I think I have
yes,
heard of that.
there's an opportunity there if you have a med spa or some custom services and all that. But if
Yeah.
the person serving you is making over 100K, then they're not eligible.
I don't know if this shifting gears a little bit. I don't know if you uncovered this in your analysis or not, but It looked as though there might be some changes to HSA accounts and how those could be used. I'm not for sure. Did you uncover anything that affects HSAs?
Yeah, so what I noticed on the HSA side is, so what they're doing is they're amending it. Like they're going to have like there's, instead of calling it the high deductible health
Mm,
plan, they're saying anything that's bronze or catastrophic,
okay.
and through an exchange program. So the reason why they're doing it is because the whole high deductible was not clearly defined and people could just arbitrarily use that and the limits were not preset.
Mm,
Well, so what they mean by bronze and catastrophic is that they're saying that anything where you literally have to pay 100%, ideally up to reach that
mm.
maximum high deductible threshold. That's one of the things that they have specified. And then the other thing is, so they're trying to also create flexibility and options for pairing lower premium, higher deductible plans with tax advantage savings. So they're trying to pair it with lower premium and higher tax deductible plans as well. So it's not, it's, I think it's like just an amendment on the language and the type of plans, and they're going to create new flavors of plans, is what I interpreted out of the bill.
Yeah, what else? There was a lot of things here in this bill. We talked about some benefits for business here. We've talked a little bit about the Medicaid, Medicare.
Yeah.
Anything, what else is jumping out at you that you think people would want to know?
Yeah, you had mentioned about like rural health, right? One thing they did in the bill, like in the chapter 4 section, is they mentioned about the rural allotment, right? So they're claiming that they're going to allot 10 billion annually from 2026 to 2030 to all the 50 states, improve access to rural health care. I know that, Medicaid hits rural per se, but I think they're considering bolster it with some additional funding, knowing that it will be impacted negatively. The question is how far that 10 billion will reach everyone is still a question mark, and how are they going to appropriate to different states, right? So
Mm,
that's a tough question. What do they consider rural? So all that I think will be shared at a later time, but it's pretty evident they're saying they're trying to promote evidence-based interventions, payment to providers, recruiting workforce, supporting technology advances, and they're claiming the states will have to submit their plans and annual reports, and they're not required to provide matching funds, which means like it's at their discretion how they're going to split out that $10 billion. It's not
mm,
very clear. So I think that's one of those relevant sections that they shared.
okay. Any final takeaways here looking at this bill? Are there, does it portend, is it mainly a business, a bill that's designed to stimulate business and stimulate the economy? Or is this kind of here to put things in the pockets of regular Joe? What's your take on that?
I think there's a mixed bag of things that create value for the lower middle class, and I think also create value for the upper class and the upper middle class a little bit from a business centric perspective. I think it's people will just have to digest what they want to do into the future and approach it that way from that perspective, because yeah, like it's not designed to favor one way or the other. Like there's a lot of communication out there that says, "Oh, the big beautiful bill is making the rich richer." Yeah, yeah, they're keeping the provisions they had put out there all these years. They're not removing it. So definitely across the world, wherever you go, there's always that divide that exists, whether in the US or any other country, it still exists. The question that people need to digest is, okay, what does this do? Yes, it creates a little bit of goodness at the lower middle class layer, creates that healthy bridge, but all this comes at a cost of the debt, right? So that's still there. It's just an ignorance that everyone has in the process. So it'll be, from time we will know what this will result in. But I think, I don't know, is there savings if they don't provide healthcare to a lot of non-US citizens? So will that create more money to fund this, or will there be a net deficit impact on this? So that's the question to ask on some of the healthcare components. Definitely on the business front, there'll be a net deficit because of the business provisions that they're giving. So that's a fact already. Like, when you give someone the ability to push out their entire expense into the future, so that's a beautiful thing. They can just write it all off, ideally. So from a business standpoint, definitely. From a healthcare standpoint, it's still trying to understand how much savings are we even going to get from all those who are going to become uninsured in
Mm.
this.
Yeah, and I just based on my I dumped all this into Google Gemini here, and I don't know, one takeaway that really just stood out for me, it does seem as though that's the one of the biggest impacts, right? Is
Yeah.
the loss of coverage for folks who are at the lowest end of the income spectrum, and what that could mean for healthcare clinics in the rural settings or even in cities. Cuts to access are going to cut incomes for clinics, you would think. And so that'll be an interesting thing if that comes about.
Yeah. So I think the another way to think of it is that the immediate impact is not direct, it's to the insurance, the payers, right? Because the payers are actually supporting the government program, so they've created a model for that. So that revenue stream will go away, especially on those programs that they collaborate with the government, like healthcare, Blue Cross Blue Shield, all these payers that are out there that collaborate with the government programs that are out there. That's an interesting thing to look at, to see, does that change their dynamics? Is it different? I think over time we will see where this goes potentially, but I'm thinking there's going to be a little bit of turbulence, but we have to wait and watch and see what the net implication of this is.
Definitely interesting that the payer angle is there, right? So you have the BUCAs and all those
Yeah.
payers that participate in Medicaid, Medicare programs. And so, yeah, it sounds like there would be impacts for them. That's an interesting observation. Any final words here, Mitt, before we sign off?
No, that's all I had. And no, thanks for pulling me in. And if anyone has any question about the big, beautiful bill, feel free to send us a message and we'll double click on that for you.
Awesome. Yeah, I think as days go by and we are able to dive deeper into what is here in the bill and what it could, and speculate more about what it could mean for individuals and healthcare businesses or business at large. I know Mitt will be adding content on LinkedIn about that, and I intend to dig a little bit deeper here into some of these aspects as well, because I love speaking to how these affect healthcare businesses. And I know Mitt does well as a healthcare CFO himself. Reach out to Mitt through LinkedIn if you want to get in touch with him. Reach out to me as well. I am a healthcare focused HR consultant. Mitt here is a healthcare focused chief financial officer, and we both have insights here to share for the healthcare industry. So thank you for listening and subscribing here to the podcast. If you have questions, please reach out to us, and I'm going to continue producing more shows. I've got more shows here in the recording schedule, so I look forward to sharing those with y'all. So thanks for joining us here for this special edition of Healthcare Leadership Live.